ABQ Health Partners pediatricians are experts in the health of newborns, infants, children, and adolescents. They serve your child's personal doctor and coordinate care to address a wide variety of concerns, including school and learning issues. Joining us now to talk more about the pediatrics program at ABQ Health Partners is Dr. Cristina Gutierrez Varela. Doctor, thank you so much for being with us this morning.
Of course.
So let's talk a little bit about the program for pediatrics with ABQ Health Partners. What does it cover?
So ABQ Health Partners has 4 locations with pediatricians and nurse practitioners as well as physician assistants. And what we do is care for the health and well-being of infants as newborns up to age 21. And really just part of the care of the family as well as just watching them grow and develop into young adults.
So is it pretty common for teens to go to pediatricians? Because, you know, as a parent, I always think you have a pediatrician until maybe 10, 11 years old. But pediatrics, I didn't know it goes that late.
Yes, it does span quite a bit. So we definitely focus a lot on our teenagers as well. And so we follow all the way up. So it's it gives us a sense of accomplishment as well as just knowing that we're caring for as newborns. And I've been practicing long enough, many of us have been practicing 20 years plus to actually see these patients graduate from high school, come back and bring us their kids to become our patients.
It is. That's great. Yes. So, doctor, what are some of the conditions that you see quite a bit in the pediatrics department?
So most of the time we care for just the general health care, well baby checkups, but also sports physicals, but also other chronic conditions that many children face, which many times we don't think about it for kids, but as asthma, allergies, diabetes, as well as other behavioral conditions and learning disabilities such as ADHD, some even times, some depression that we'll have to deal with. So it's a huge range of conditions that we'll treat for them.
That's great, very comprehensive. It's good to know that the mental health is a major part of that as well. Now you mentioned sports physicals. You know, this time of year, lots of students getting ready to play football, basketball, whatever. Another thing this time of year, parents talking about are immunizations.
Yes.
So they can get that with the pediatrics as well.
Yes, and we definitely encourage. The majority of the immunizations are given before age of 4. The vast majority by age 1 have already been given. But definitely you need to follow up with the pediatrician because there might be some you may have missed. Definitely between age 11 and 12 is another big time that we do the boosters. But as well as this time of year for flu vaccines. So we should start having the flu vaccine in clinics starting now as early as late September, next month in October. And it's a good time, especially to protect even as young as 6 months that we recommend them to get the flu vaccine. And to protect those in the family so that the newborns who may be exposed, are also protected.
Absolutely. Now, just very quickly before we get out on the immunizations, everyone should get one. Is there anyone in that sort of adolescent pediatrician care that should not get a flu immunization?
No, there's pretty much everyone.
Pretty much everyone should get it.
Yes.
Okay. So if someone wants to set up the immunization, they want to do a sports physical, they have any other pediatric concerns, what is the best way to get in touch with you?
Well, definitely you can give us a call at our switchboard, 262-7000. It'll direct you to all of our 4 sites in the city, as well as abqhp.com.
Okay, fantastic. Which, of course, we will have that link at casa.com. Doctor, thank you so much for bringing this information in. Again, guys, for more information on ABQ Health Partners and their pediatricians, head over to casa.com.